Good afternoon, everyone. Welcome to our webinar this afternoon that's entitled Overall Health, the Key to Employee Well-Being and After the. My name's Leah Nord. I'm the Senior Director of Workforce Strategies and Inclusive Growth at the Chamber of Commerce, and I'm pleased to be moderating the session today. As always, today we'd like to thank all of our CBRN sponsors. Today, a particular thanks to Desjardins. Said that, we're very pleased to welcome our speaker today. I'm going to introduce her and then hand the floor to her. Charmaine Alexander is a senior advisor in disability management at Desjardins. She has more than 20 years of experience in group disability management, spanning a variety of industries and working for employers as well as insurance carriers. Client base, Charmaine promotes a focus on prevention, encourages employer groups to encourage their employees to take charge of their health. Believes the future of group disability plans will require a collaborative approach between all stakeholders. The best practice and innovation team partners with several organizations within Desjardins' portfolio of clients to deliver educational presentations to employers, employees, and union leaders across Canada, and aim to strengthen best practices management of disability claims. In 2018, Charmaine became the first insurer-sponsored health first aid instructor certified by the Mental Health Commission of Canada, and used to deliver this course to client organizations and their workforces. A fellow in life and health claims from the International Claims Association, she also completed her studies at York University with a BA in English and at George Brown College in Nursing. So with that, good afternoon. Welcome, Charmaine. We're delighted to have you today. We're going to hand over to you the floor, and if you can share your screen, I think you have a presentation. Yep. Thanks very much.
Thank you, Leah. So let me go ahead and do that. And great. So good afternoon, everybody. It's a pleasure to be here to talk to you today. It's a beautiful day here in Toronto. I hope it's nice where you are too. And so if you feel moved to, feel free, take me out on the patio. I'd love to sit and have this chat with you. So thank you for the introduction, Leah. As she mentioned, I'm a senior advisor at Desjardins. And before we get into the meat of our presentation, I wanted to ask you a question. How are you? So this is a simple question, and really, if you agree with me, it's a really different question before pandemic and post-pandemic. Before, you know, when we were all in the office, we'd pass each other by, you'd say, how are you? And it would be, oh, I'm good, I'm fine, and usually go on about your day. But now, what we're going through, what we are facing in the pandemic, that question really takes on a different connotation. There's a lot more to when someone asks you now, how are you? They're really asking, how are you physically? How are you psychologically? How are you financially? Because in this time, we're establishing a new normal, and it's now more evident than ever that the physical, psychological, and financial health are all interconnected. At Desjardins, we call this equilibrium between the components, overall health. They interact like balls in a pendulum. What affects one usually affects the others. So prior to the pandemic, back in May 2018, Desjardins actually conducted a survey, and we wanted to measure these interactions to better understand how they affect each other, so that we could be better equipped to see what was coming and to respond to it appropriately. And what did our survey find? 83% of healthy people say that they can manage their financial stress. And 73% of financially healthy people also reported being in good mental health. Conversely, 43% of people in poor physical health have a hard time managing their financial stress. And 61% of those in fair or poor financial health also say they struggle with mental health issues. So clearly these three factors are very closely linked, no matter what your situation is. And that was before the pandemic. But March 2020, wow. The coronavirus completely upended all aspects of our lives: work, family, recreational activities. Suddenly, kids weren't going to school anymore. We were working from home if we weren't before. We couldn't see friends, and we had to line up to go to the grocery store. The world as we knew it suddenly imploded, giving way to uncertainty and really more questions than answers. Are my parents okay? Groceries safe to eat? Will I lose my job? Should I wear a mask? Can I see the doctor? Will I still be able to retire on schedule? All of these questions to different people, all of them important. After 6 weeks of lockdown, the research firm Angus Reid asked Canadians the question that I just asked you at the beginning of the presentation. How are you? First, the good news is that about a third are coping well with the situation, but for others, it is another story. So let's start with physical health. We know that the virus attacks the body directly and indirectly. So let me explain that. You might be asking yourself indirectly, what does that mean? So since March, we've been given a lot of information on the virus itself, especially if you're like my parents and you watch CNN. We know how it can spread. We can try to contain it, but there's always new information coming up, and it's difficult to know exactly what to believe and what to do. But this is really the direct effect of the virus. The indirect effect talks more to how the presence of the virus has affected people physically, even though they have not contracted the virus themselves. So while the economy has ground to a halt, chronic illnesses haven't gone away. There have just been fewer diagnoses since people haven't been able to see the doctor. And we were seeing that in the emergency rooms because there are people that were presenting were usually COVID related, but fewer patients were actually attending if they had issues otherwise. So as insurers, we can expect to see a rise, and we're expecting to see a rise on disability cases in Q3 and Q4. Radical lifestyle changes have also taken a toll on physical health. For 2 months, Canadians were told, stay home, and they did. 63% of them spent more time watching TV, 22% spent more time playing video games, and 25% were drinking more. Canadians pretty much aged 35 to 54, according to another survey. 4 in 10 Canadians reported having trouble sleeping since the crisis started. The lockdown is also affecting our diets and levels of activity. We all heard about the freshman 15. Nobody told us about the COVID 15. Many people have gained weight from lack of exercise. I don't have the number specifically for Canada, but a study in France showed that 57% of French citizens reported gaining weight during the lockdown. For people already suffering from obesity, a chronic illness that affects 7 million Canadians, according to our partner Obesity Canada, the current situation just makes that problem worse on a number of levels. I'm not judging anyone. We're all doing the best that we can. But our role as an insurer is to anticipate the consequences of that. So less physical activity, more alcohol, more calories, and chronic lack of sleep. These are all ingredients of a time bomb. On top of physical issues, employees are also dealing with ups and downs in their mental health. The Center for Studies on Human Stress, and there is such a center, identified the 4 main stress factors. And typically it only takes one of these factors to trigger a stress response. But since mid-March, all 4 have been affecting our day-to-day lives. So ironically enough, the acronym is NUTS. So N for novelty, U for unpredictability, T for threat to the ego, and S for sense of control. So novelty. We haven't seen a health crisis of this magnitude since World War I and the Spanish flu. Unpredictability. Facts about this virus keeps changing from one day to the next. Threat to ego. Some people have lost their jobs or are afraid of losing them. And sense of control. We have no control over the virus or how it develops. The results? 50% of Canadians say that their mental health has declined, with another 10% reporting a severe decline. Worse still, a study done by Sherbrooke University revealed 26% are experiencing symptoms of post-traumatic stress. And normally we only see 5 to 10% of the population developing this disorder during their lifetime. How about financial health? It's no secret that people were struggling with their finances even before the crisis hit. Borrowing was all at an all-time high, with 44% of Canadians reporting that they were living paycheck to paycheck. People have been hit hard with loss of income, mass layoffs across several different economic sectors, restaurants, air travel, tourism, entertainment. And due to the high cost of living, many people didn't have savings to fall back on. As a result, by the end of April, 1 in 3 Canadians reported that the situation had affected their ability to pay their bills and meet their basic needs, like rent, mortgage payments, utilities, and groceries. Now, thinking back to that image of the pendulum with the 3 spheres of health, you can easily imagine the combined effect of the current situation on overall health. Here's the key number to remember. 26% of Canadians are in mental and financial survival mode. They're the ones struggling the most, with 25% of them also reporting trouble with their relationships at home. There have been articles that suggest social distancing at home has led to an increase in divorce rates. That means 1 in 4 Canadians aren't doing well, and our employees, your employees, could very well be among them. For companies, this can lead to a drop in employee engagement and productivity. Normally, teleworking boosts productivity by about 13%, but things haven't been normal for the past 3 months now. Employees have been pouring a lot of their energy in learning how to be resilient. They have a lot on their minds. Employers have had to adapt to this reality, and really very few had a contingency plan in place to deal with this catastrophic event. Many employers had to act fast, adapt on the fly, and to their employees' new needs and expectations. The first of these expectations were new work tools. In just a few days, employees had to shift their entire staff from the office to teleworking and video conferencing mode. If I had a dime for every time I was on mute when I started talking, you know the challenges. It's a huge challenge in terms of technology, training, and standardization. To add to this, there were personal expectations. Stuck at home with children and all that entails, employees really needed their bosses to be flexible with hours, with deadlines, and compassion quickly became the new buzzword for a lot of managers. The third expectation, especially from those that may have lost their jobs or were on the brink, not knowing what was going to happen, information was really important. And support, such as government assistance and relief measures offered by insurance companies and banks. It's as if this crisis had given rise to a new bond of trust. So let's look at the employer's role in this new relationship. Looking back at the timeline of events and their impact on the management style, we see that phase 1 corresponds to what happened in March. Economy was put on hold and the lockdown measures were introduced. The primary objective for both businesses and employees was really survival. As the previous slide, as employers, many of you had to take action and implement emergency measures. Your communications had to be clear, transparent, and conveyed with empathy. For those employers watching here today, I'm sure you can relate to this. In April, we moved to phase 2 with the need for security and guidance. That meant businesses, employers had to show that they were confident, that they had to reassure their employees about their jobs and about their future. Employers encouraged their employees to focus on their strengths and work within their comfort zone. And employers needed to take a compassionate approach to understand and to be flexible. Today, although we've eased up on confinement, rules and we've somewhat restarted the economy, we're somewhere between phases 4 and 5. In May, we entered the belonging phase. people were gradually adapting to their new routines and wanted to connect and reconnect with others, their community and their colleagues. We started setting up video conferencing platforms for virtual happy hours. I know we did our lunch hours with people we used to eat lunch with and our greater team to help foster unity and help foster unity, and communications really took on a lighter, friendlier, and less serious tone, all while still being empathetic. This was important because work relationships are one of 5 drivers of workplace happiness and account for about 45% of a person's overall job satisfaction, well ahead of their salary expectations even. So in phase 3, we really tried to rekindle this driver and renew team spirit. Today, in August 2020, we have entered phase 4, realignment. So this is where employees will think back on their choices, the way they've coped with the crisis, and how they were supported, and how they were managed, and how that support that they received. This is normal and it's very healthy. They will make personal and professional decisions, and they'll want to make sure that their company's values still align with their own. Some will jump ship, all very normal and all very healthy. Organizations can also take this opportunity to reassess their values and fine-tune their employer brand to develop a culture that's stronger than ever. Their communication should convey authenticity, even if that means admitting mistakes were made. As we are now headed toward phase 5, companies and employers will look on formalizing those new practices that emerged over the past few months. Teleworking, work-family balance, and compassion. If they haven't done so already, employers should express their appreciation for their teams, who will come out of this slightly worse for wear, but more tightly knit than ever. A new reality, or rather a new normal, will take hold. To sum up this transition to empathy, I would say the pandemic led us to take better care of our employees. The companies, employers that weather the storm will be those that have risen to this challenge. Professor and consultant Jean-Pierre Brun coined an expression a few years ago that is more relevant than ever now. He said, it's time to go from managing human resources to managing resources humanely. So as we move into the future, humane management means, 1, implementing a culture of overall health, combining physical, mental, and financial health. Financial health can no longer be overlooked. It's really an important component when you're considering employees' health. Fostering empathy in managerial practices to improve the employee experience. Choosing business partners known for treating people well and giving back to the community. This shift to more compassionate management practices happened almost organically in some organizations. The key now is staying the course throughout this crisis as it becomes a long-term reality. Physical distancing and teleworking may be here to stay. As employee wellness experts, we're happy to provide you a few solutions on how to stay the course. The first key into moving into our new reality is information. Information is key to success. Moreover, the way that information is delivered is the key to well-being. The first piece of advice that you can give your employees is to change the way that they keep themselves informed. So when you're having meetings and talking about what you've read, what you've seen, really reinforcing that watching the news about COVID maybe once a day is more than enough. And there's no need to stay glued to the TV 24/7, because it can be a major source of anxiety and toxic websites, fake news. For anything that's health related, when employees have questions or yourself, you should encourage them to consult reliable resources. And this can include trusted websites from your insurance partners, from your other partners, health and wellness platforms. Often these are full of articles and advice. At Desjardins, we saw a spike in the visitors to our actual health wellness at the beginning of COVID and the pandemic. During that first week, there was a lot of people researching information. And it just goes to show you that people want to know, they want to understand, they want to know next steps. So really trying to influence where they're looking for that information is really important as we go forward. Many insurers and health partners also added videos and webinars on the situation. For example, as soon as the markets crashed, we, Desjardins, posted a video online to reassure plan members about their financial portfolios. It talked about best practices to adopt, remaining focused on your established objectives, not making any rash decisions. And a lot of our plan sponsors proactively shared the video. So again, really disseminating that information to the employees, because it does respond to a real need. The news makes people anxious about their financial future, and they wanted a credible point of view in the situation. So making the most of your partner's information, a lot of things that you can find on websites and trusted webinars and videos is something that you can also share with employees. In the end, our video was viewed by thousands of plan members across the country. And this is just one example that really shows that it's more important than ever for employers to promote and share all the tools insurers, vendors, partners provide. It's an easy and inexpensive way to help employees regain their peace of mind. Beyond information, employees may need personalized help to overcome some of the challenges that they're facing during the crisis. In the beginning of the presentation, we looked at some of the physical health and some of the things that happened during the pandemic and COVID that are really impacting that. Again, your insurers, partners, vendor partners can be an ideal partner, since many group plans now also include one-on-one coaching programs. So tying back again to some of the earlier statistics, sleep, weight issues in particular come to mind. On the financial side, for example, Desjardins also offers global integrated experience. It gives plan member savings information, tools and services, and appropriate recommendations to suit their individual situation. But again, your vendor partners also really important source of information. Each plan member has convenient access to counseling on their needs and their goals and issues that might concern them. It incorporates financial wellness into their lives. The industry has also developed new wellness programs that are proving to be very effective in providing support for employees. In the same vein, there is a whole new range of new technological options available to help employees stay healthy. Virtual healthcare or telemedicine, which enables patients to consult a healthcare professional by phone or tablet for non-urgent problems, is definitely becoming more popular, especially through the pandemic. It has proven valuable resource. It has proven to be a valuable resource. And it's not just because it saves employees time, because employees were being cautious of attending clinics or maybe even couldn't, and cautious of attending emergency rooms. It really was a viable option for them during this pandemic. Better mental health tools are also emerging. You can use that in the virtual healthcare as well. But EAPs have been incorporating artificial intelligence to some of their member portals, so that it makes it a lot easier. And certainly with people becoming more adept at technology during this pandemic, it's another viable option for them. Often before talking to someone, employees can fill out or are more willing to fill out an online questionnaire and get some assistance that way. Online cognitive behavioral therapy as well, ICBT, is just another means of reaching people in the comfort of their own homes and at their convenience, and also respecting social distancing rules while still getting the help that they need. Virtual services are also part of employees' new expectations. One recent study shows that 62% of Canadians are willing to consult a professional over the phone for mental health services, compared to 40% before the crisis. Again, it's as though circumstances have broken down many people's resistance to technology, and this is a great opportunity for employers. Now's the time to add high-tech tools to group insurance plans. Communication, I've talked about it throughout the presentation, but again, communication is also part of the solution. It's obvious that employers, you can't necessarily become your employees like therapists or close friends, but you are a resource of a source of moral support right now. And it's important to develop a new way of communicating that's focused on listening to your employees. It's important to be responsive to your employees' needs, their expectations and concerns, and asking how are you at the start of a conference call is all well and good, but listening to that answer is even better. Not just with your ears, but with your eyes, your heart. The idea is to pick up on any early signs of trouble. Is my employee being neglected, feeling tired? Is there something that you see that might be different? And certainly, even one-on-one, giving somebody a call and asking them, how are you? All important to understand and get ahead of it if someone is experiencing some distress, either physically, mentally, or financially. Communication also means maintaining social interaction between team members and holding informal online meetings. For example, the morning coffee chat, the virtual happy hour, things, even coming together like swapping recipes. I know I have a colleague who likes to, with her internal team, they like to pick a theme and dress up as that theme when they get onto the call. So again, really working in our new normal and working with our technology. In this day and age, communication is kindness. So as you can see, managers, team leaders, and supervisors are the cornerstone of overall health approach. But its success also depends on getting support from senior management and strengthening organizational practices. What does that mean? Essentially, injecting a good dose of warmth and humanity into your management of people and your business. So let me just go into a little bit more detail. Even though Gen Y and Gen Z employees account for an increasingly large proportion of the workforce, many organizations have actually stuck to the baby boomer or Gen X way of doing things. Hierarchy, objectives, performance, strategy, sense of duty, all very vertical. But with the pandemic, organizations were kind of forced to adopt new practices like flexibility, solidarity, cooperation, transparency, which are typically horizontal and more sensible. They're the values of the young employees. And this horizontal revolution was already going on, but the current situation has just accelerated its course. It's really one of the only good things that may have come out of the pandemic, the introduction of heart into business. I like this image of baking bread at home with the kids. I don't know about you, but all of a sudden everybody was baking bread, baking banana bread. I've eaten my fair share of it during the pandemic. But still, this image, there's something comforting and elemental about it. We're in survival mode, but we're also human beings with know-how. And I think that's a good way to wrap up this webinar. To summarize, the concept of overall health is the next step in the evolution of employee benefits. It should be at the center of business plans, driven by values like goodwill and cooperation. In the current situation, this new model naturally fell into place. Faced with a crisis, companies had no choice but to take care of their employees' physical, mental, and financial health. They had no other option but to alter their organizational practices and come up with a new way of working together in a spirit of cooperation and collaboration. In the future, this will be the new normal because it touches on all components of health and all drivers of well-being at work. Thank you for your attention.
Charmaine, that was wonderful. Thank you very much. There's a lot to digest there and a lot that we could highlight, but I just want to say in particular, I really appreciate those data points. A lot of things that we think are happening ethereally, you know, or not common sense, but we see happening, that's really backed up the data. And what we're going to do here is I'm going to move directly into questions because
Sure.
they're all, and Charmaine, as you can appreciate, this is very timely and very real for those on the line and our network across the country as we grapple with this, that pillar 5 that you referred to here, the, this new reality piece.
Mm-hmm.
So as these questions come up, if you've already answered them through the presentation, just refer back to that, or if it's sort of beyond the scope, because there's more questions than answers, as you can well appreciate. So the first question is, how can we make returning to the office fair for all employees, yet still work with each employee's unique situation? For example, childcare or immunocompromised family members.
Yes. So again, it goes back to the communication part where you'll have to listen, and really it might take individual situations. You might have to consider the individual situation. But what we found, and what I found even through working with clients, is really making that process transparent. So when someone comes to you to talk about their concern about living with immunocompromised relatives, and so on and so forth, when you talk to them, really asking them to talk about how they see what you can offer and what the solution, come up to with a solution together, and really again be transparent about that process, understanding what you have, what compromises can be made, and what might have to take place before they can come back and feel safe about that. But it will take a lot of maybe trial and error, and definitely like listening to each other to understand what the concerns are, and talk about what those barriers might be. But again, information, transparency, and really communicating.
Great. Thank you for that. The next question is that the following: work-life balance is hard to strike during normal time. Financial constraints are putting employees, and they are unable to take vacation. How can you recommend that employees relieve stress?
Hmm. So yeah, that's really difficult. Again, maybe it might be something that can work, if it's possible for them to take a day or two, or finding some other compromise. If it's Personally, we would encourage, as much as possible, employees to take some sort of vacation or some sort of break. I know it can be difficult at times, but if there's some way that you can sit down and look at what you can really sort of afford to do as an organization. If you can't have people away for blocks of time, then maybe it's a day or two. Maybe it's holding a sort of a team meeting to talk about that. But again, a lot of communication and transparency. If it's the fact that people are feeling unable to go anywhere, there's some people that really have to leave the city to feel like they're on vacation. They're not used to the idea of staycation. Sometimes thinking about what was it? I think somebody had looked at picking a place in the world and actually looking at it online. You know how you can do Street View through Google or something? Really coming up with some other ideas, but importantly, to really encourage your employees to take some type of time off if it's possible. And again, like maybe a day, maybe an afternoon, talking about stressors that they might feel, and how you can come up together for a solution.
Thanks, Charmaine. And we do appreciate these questions aren't easy, but it's insightful answers, right? And you've got from where you sit, a view that's helpful to us all. So appreciate it.
Great.
The next question is that all employees have access to our employee assistance program. Utilization is very low. We get our employees to use this service.
How can you get them? So everybody has their own level of comfortability. Sometimes it takes just telling people about it. Maybe they're really, you might, it's one of those things that you think everybody knows that we have access to EAP, but they may not know the nuts and bolts of it, of how to go through it. So usually what I like to do is approach it by saying, oh, we do have EAP as well. Sometimes I even drop it in regular conversation. Let's say I'm talking to somebody, one of my colleagues, and maybe they're not struggling, maybe they are, maybe I know that, maybe I don't, but I might talk about, yeah, it's really tough. I've had a day with the kids. They've really, it's really been hard managing working my hours, and the kids have demands from me. I don't know, but I'm thinking about calling EAP, trying to make it as normal as possible. I know I've used it myself, so I feel very comfortable telling a colleague I've used it. It's really easy. Pick up the phone, someone answers it, and I give them a little bit of how to go about it. You can pick up the phone. If you don't want to do that, maybe you can access it online. You can try it, or try the virtual healthcare. But again, a lot of the, I think, barriers to using the EAP is, one, people are afraid of what to expect, or they really honestly don't know how to access it, or they don't know the number. They don't want to look it up. I know I've been sometimes guilty of that as well. I want somebody to tell me, what's the number? So again, using all of these strategies, and again, trying to normalize it, trying to take the stigma away from it, saying I had some great advice on work-life balance, or I had some issues with talking about deferring a mortgage payment, and I was able to talk about it with someone at EAP. People tend to do things that are promoted word of mouth. And
advice, Charmaine, and folks, colleagues across the line. As we do this, I will encourage you to look at the app here and sort of add questions and upvote. Normally, I would try and triage here. It's a bit more difficult as I flip through them, but just because we are talking about EAP, Charmaine, I did see a question come through. You had mentioned this idea of EAP and AI. AI being increasingly implicated. I think it was through an application, but can you give us an idea, like what are the
Sure.
trends, or maybe a few examples? That would be great.
Okay. So embedded in our EAP, we have a component called Epsilio, which is our AI with our partner. And essentially what it is, it's artificial intelligence that's been loaded with, I believe, I might get the number wrong, but thousands of different questions and different scenarios. So what it is someone can access it online, and they can talk to this AI, and they might enter in something like, I'm really having issues finding work-life balance. My kids, I'm feeling depressed, and the AI is programmed with looking for those keywords, and then they have a set of answers for that, which are geared towards an action plan. So it might say, oh, I heard you say that you were depressed, or you were having some you feel like you might be having some depression. Here are some resources, or here is, did you try this? And depending on what the keywords they pick up, it will go deeper into questions that were already, again, preloaded. And because it's not an actual person face to face, it's like one of those chat bots. It's what we found is it's sometimes easier for people to open up. And then, of course, it will lead you to calling the EAP number, or considering, this action versus that action. Did you talk to your family doctor? Maybe you should call that. But it does come up with solutions. It's also quite intuitive. I know there's several of my colleagues that have tried to fool it and trick it, but they weren't able to. They weren't successful, and it really always led them to something that they could tangibly use and take into either EAP or into another healthcare professional.
Great, thank you. That's insightful. And really interesting as well. And your that you can always speak to someone at the end of the day, but that how some are more comfortable going down that path first. So this question is, how can we strike the right balance of caring for employee mental health, at the same time letting them be responsible for doing their own mental health work?
Yes. So that's a great question, and one that I've actually come to really understand that more through my training with the Mental Health Commission of Canada and the Mental Health First Aid. What we stress a lot in the actual course is that you can't be somebody's therapist. You can't be, you know, even somebody's, let's say, confidant, because you yourself will take on a lot of baggage, if you will, by it's again very difficult to strike that balance. So what is really important is to listen to someone, but also be ready with resources that you've seen or you've researched, such as EAP. So you might see a colleague or that's struggling. Maybe you're on a team meeting and you see that person who's normally, you know, upbeat and you know, maybe just noticed a little bit of difference in their behavior. Connecting with them personally and saying, is everything okay? I just noticed that you were a little different. I just, you know, oh, no, I'm tired. Oh, well, you know, okay, that's great. But if you want to talk about it, I'm here. And then consequently, if they do contact you, connecting them with, again, a healthcare professional. So being compassionate and listening, but then saying, you know, I really think you should give this a try. I really think you should contact EAP, or I really think that you should talk to your doctor. I really think, you know, I've found some really great resources on the Canadian Mental Health Association. But really familiarizing yourself with local resources, with something that you might have used, something that might have helped you, or, you know, researching that when you are coming into that conversation with that person, that colleague, because the goal is always to acknowledge the fact that this person has entrusted you with that information, but then you are not the professional, but you want to help them, you know, be a conduit in that. Here's the phone number that you can use. Here's what you can maybe research or look at if you're interested.
Conduit, I really like, yeah,
Yes.
that term and that idea as well, because it
Yes.
also gives the, you know, at the end of the day, the individual does have agency too. So they do. So I mean, I'm going to preface this. There's a whole category of questions here through this. So,
Sure.
And they're difficult ones. We'll ask them now, and then I'll sort of,
Okay.
whoever's moderating, you're going to see me flip through them. But it's, you know, this whole world as we return to the new normal, and there's still this period for the foreseeable future, you know, when we don't have the vaccine or there's still concerns. And as we open up, it's around work refusals and tips and tricks, you know, that's sort of at the, I think, the most extreme of this spectrum, but, you know, tips and tricks as well to help resistant employees to transition back into the office. And then, you know, because we talked about, you know, those who have concerns, or even preferences. We've got, you know, those who
Yes.
who are resistant, and then those
Yes.
who are refusing. If you could, and maybe I haven't even categorized it right, but if you could just walk through and provide some, you know, advice or even, you know, resources for that, because I know a lot of us are dealing with that as well.
Okay, so let me understand the question correctly. So for the different categories of people who are getting ready to return to the office, their concerns with, give me those categories again. Sorry.
These are just, so one of them was work refusals. Another one is tips and tricks to help resistance employees. So maybe I'm trying to meld categories together, which can't be melted. But when we return to work, how can we help those resistance? And then when you actually hit a refusal, what can you do?
Right. Okay. So again, it's kind of a common sense approach. You need to find out what the resistance is, and what the refusals are, and you sort of need to take each component and find reliable information and resources behind that. For example, if we're having somebody with a resistance, and the resistance is because they may be immunocompromised. We've all heard and seen those articles about people with, for instance, diabetes, that may be extra fearful because, and that's something very common enough in our workforce, that they may, you know, absolutely be fearful of returning to work. So really arming yourself with a lot of information as a supervisor on sometimes that information. Maybe they will share that with you, maybe they won't. If it's a medical issue that they're really concerned about, you might have to talk to them about the options that they have with HR. Like if if they feel that they need to submit a claim, they might have to go through that whole process to understand that. But again, really discussing what those barriers are to them. Maybe it's, again, living with immunocompromised people. So, reiterating the information that's available on health and wellness websites, and certainly with your either Desjardins or your other vendor partners, they would have tips and tricks for COVID, and they would talk about certain situations like that, where washing your hands or wearing a face mask around those other people around that you may be living with that's immunocompromised, talking about what that looks like for them. But it's almost how you really have to approach it on several different levels. You have to listen and understand what the concern is first, then you have to address that concern with reliable information. And then, of course, if it's an absolute refusal of no, that you might have to, again, address it from a human resource point. If there's something else, it might just be giving way to another issue that you may or may not be aware of. So again, really listening to what those issues are and providing reliable information that shows that maybe that person, yes, their concerns are real, but this is how we can help mitigate that. Or would you feel comfortable entering into, like, again, would you feel comfortable if we made these changes to your workstation, if you are able to, of course. But again, talking about those barriers, being transparent about those barriers, and then understanding. And if you do come to a impasse, then there will have to be some type of more human resource expertise beyond my disability management expertise. So.
And thanks. And I see how these questions are sort of melding, but I'm just going to read them one at a time here because it was. So the next question is, how can we try to address individual employee needs for supports for physical, mental, and financial health as a result of COVID-19 through a group?
Through a group, yeah. Sorry, I didn't get the last word.
Through a group plan.
Through a group plan. So through the physical, again, there's a lot of information typically on your insurer partners, your wellness site, whatever you have with them. If you call your representative up, I'm sure if it's, for instance, your group retirement services, whoever you have your group retirement services with, asking them for information, they've a lot of companies have developed information for these types of situations, maybe not COVID specific, but if they haven't yet, they are definitely coming up with new, let's say, information on having to address what people feel financially, their financial uncertainty. So making the most of that information that they already have. I mean, a group retirement services is more than just retirement services. They need to be able to educate you on your portfolios, your investments, and so on and so forth. So using those resources to help address your individual employees. And again, physical and mental health, that usually goes hand in hand. A lot of that information is on wellness sites. Again, individual resources, if you've done some research yourself on the internet or through organizations such as the Canadian Mental Health Association, the Mental Health Commission of Canada, there's Bounce Back Ontario and across the country. A lot of these resources for mental health and physical health. Again, usually with a wellness site, there's a wellness library, a lot of information. Sometimes there's specific articles. They talk about diagnoses, common medications, really tapping into that because there's a wealth of knowledge on those wellness sites.
Thanks. question, and again, we've touched on it a little bit here, but
Mhm.
how can employers better support the well-being of workers experiencing burnout?
Hmm. So again, it has to be listening to your employees. Uh, a lot of you that are maybe you meet in a regular team space. I know our disability teams here, they take care to do weekly huddle, so to speak. And sometimes because we are it's great that we have this technology, but at the same time you don't physically see somebody, so it may not be as apparent that there may be burnout if they don't vocalize it. But again, trying to be intuitive in making sure that you have that in the back of your head, you might be more inclined to ask your team, your colleagues, like, hey, how are you doing?
Hmm.
I it seems like I'm really busy. We have a lot of deadlines. How are you feeling about that? You might have to be more direct. It's a little like, when you're, you can't be together physically, so you have to take, and you don't have any nonverbal cues. You might have to ask it directly and say, are you feeling burnt out? It's okay to talk about that because, i- with what we're going through, that might be a real reality. And if they do express something like that, again, using the resources for mental health, for EAP, for if they don't want to do that, if you know that there's an AI component, hey, you can try this. This isn't, you don't have to call EAP. You might be able to go online and talk to the chat bot. I found it really helpful. It might be something that you might want to do, or I heard it was really good. Should try it. But yeah, again, mitigating that and really trying to be in tune with your employees and your teams. It might have to be a combination of being direct and also trying to notice any changes in behavior while you're in your regular meetings and regular work days.
Yeah, and there's almost a second part to this, Charmaine, but I think you've answered it, but I'm going to state the
Mhm.
question in case there is additional,
Sure.
but I think the same would apply because it was talking about stress levels, but this question specifically speaks to middle management stress levels with having to implement
Hmm.
COVID policies. How do
Hmm.
you address that? Well, for the examples you gave, that level that's doing the implementation, would you
Hmm.
say anything additional, or would it's what you had said before?
Yeah, and they're really in, again, difficult, sort of being the middle management. You do need support from senior management, of course, but you are also taking care of a whole team yourself. So typically there may be EAP resources for you. I know at Desjardins we do actually have a program that's really aimed at managers, at supervisors, at the middle management, as you say. It's called our corporate assistance program, and it's specifically, and it's good to ask your partners because I'm sure they may have something similar. If you're not with Desjardins, where it allows the manager or the middle management people that are implementing these COVID policies and such, 12 extra hours of psychological treatment, of discussion with professionals on how to do that, how to deal with that. I'm having resistant employees. What do I do? Again, it's something that they get extra hours specifically in recognition of the fact that they have that dual responsibility. They have to take care of themselves because they're taking care of a team. So again, some resources like that, definitely partners should have something, but being cognizant of what you need to be cognizant for your team, because in case you see them struggling, so using those resources yourself as well.
Thanks. And we have about 5 minutes left, so I'm going to try and group maybe these
Sure.
into three sets of questions. And the first
Okay.
one is going to be around, Charmaine, how to help those employees with barriers and disabilities.
Mm-hmm.
A related question is how to, make sure you're AOCA compliant. But any
Yes.
background and advice you could provide on that would be greatly appreciated.
Okay, and again, looking for your reliable information, you might need to get functional forms or functional information, not, of course, not accessing anybody's medical information, but getting details on restrictions and limitations. And then once you have an idea of that, or even in discussions with that, having to address those again, being cognizant of what the restrictions and limitations are and what you're able to do as an organization. If it means that you may have to take a step back and delay someone's return to the office while you put things in place, be transparent about that. Be very clear that this is because we want you to be as safe as possible. So we don't want anybody to get the idea that, oh, because it's an extra step to bring them back safely to the office, that this is we're delaying it or anything like that. Again, be very transparent, and try to get as much knowledge around the restrictions and limitations that you can when you are bringing them back safely.
Again, very helpful as we all struggle
Yeah.
with this on a whole bunch of levels. So I'm gonna take the prerogative. There's gonna be two more questions here,
Yeah.
Charmaine. And again, we put you on the firing line, but these insights are so really full and even give us
No problem.
food for thought. So
Yeah.
the first question, and again, this isn't a big bundle, but it's how I think you've addressed some of it about how to connect with those staying when you work from home, right? How to stay connected, actually ask, look for those, be more direct in your clues, your different huddles. But how do we talked about burnout from home, taking time off, but how do you help employees who are home, will remain home for the foreseeable future, or some kind of hybrid, separate work and home when you're in the home? Thank you.
Yes. Okay. So really, again, encouraging them to take that time. And maybe it goes to even asking them what kind of hours they're keeping. Maybe they have younger kids that are actually, so they earlier in the day, maybe that's devoted to being with the kids and they have flexible hours. I have a colleague that has a toddler, so she works later in the evening. So understanding what that is first, in their work-life balance, what that is, and then again asking them, okay, so you're going to be working from this time to this time. Where's the time that you're going to take some time and some rest for you, or some self-care? Being very cognizant of where that is, and of course, if they're talking to you about what their day looks like, and it doesn't look like there's an hour or two in there. Really encouraging them to take that and to talk about it, to say, hey, are you taking a lunch break? Are you just unplugging? I want you to try to unplug at least for half an hour, so that you can reset. We care about you. Is there something that we can do, we can help you with, to help facilitate that? But again, being kind of cognizant of each of your employees wherever possible. I realize that maybe for some of you that's a very daunting task, but understanding what that looks like for them, what their workday looks like for them, typically, and then discussing and trying to find a time and place where they can actually have some respite, have some time, yeah, and do that, if it's a vacation day, or if it's some time off.
There's so many questions here, Charmaine. I think we've covered a lot of them, because you've been really, again, because it is, how do you stay positive, medical,
Yes.
so on and so forth. The
Yes.
last question I'm going to ask you, and it might be, again, if it's beyond your scope, please say so, but because this is a bit of crystal balling for the industry
Yes.
writ large. Is there any indication yet of how the industry, how the claims that are being made will affect the insurance industry sort of writ large? What's
Okay.
sort of the future of the industry, if you could?
Okay. So right now, we're kind of holding our collective breath, because, as I mentioned in the presentation, we do know that there has been a large contingent of people that may not have been seeking medical assistance for symptoms, and they may be undiagnosed with greater medical problems. So again, we're not sure what to expect in Q3, Q4. We're expecting to see a rise in disabilities that are not COVID related. So someone that may be, for instance, again, to use the diabetic example, may not be having, regular sugars or whatnot, but was afraid to seek medical advice or couldn't. And now they're at a much more dire stage of their disease, let's say, than they might have been 2-3 months ago. So those things is what we are fearful of and having to deal with. The other thing is that what we've seen is as we adapt to this new normal, getting information from doctors. So like if you do have employees on disability and getting them back to work, returning to work, that's been a little bit of a challenge to get that information from physicians, to get that information to either approve a claim or again, put somebody back to work. So the durations we've seen is a little bit of a challenge as well currently. But as we move forward, we're putting in things in place. Doctors are more willing to talk to us and verbalize medical information on the phone. So again, I would encourage you, like even when you're talking about how to deal with certain, as the questions were before, I suspect, or is there something I can do? Talk to your disability teams as well. They might be some help and some knowledge because they also do know resources. Rehabilitation specialists at your insurance companies also have resources in terms of internet cognitive behavior therapy or tips and tricks for dealing with those people that are coming back, resistance in terms of, restrictions and limitations and how to work with those.
Thanks. Yeah, it's, ramifications, right? And so many vectors.
Yes.
So,
Yes.
so,
So
and yeah. And I'm realizing the time, and I know folks are going to start dropping off if they haven't already, just because we have already run over a little bit. But Charmaine and Desjardins, I just want to really thank you. This has been really helpful, really informative. I really liked how you spelt it out with the data and the visualization, and we're able to give these insights. And colleagues across the country, I thank you for participating today. Thank you for taking the time and being very thoughtful with your questions as well. I wish you all a good what's left in your day, and please take care.